Hi, this is Dr. Divya Sundaresh. I'm an oculoplasty surgeon. I am a surgeon from Bangalore and I also work at Zamindar Eye Centre. So, facial spasms or facial tics, hemifacial spasms are mainly when the facial muscles are twitching. It generally tends when the entire one half of the face is involved. There can also be muscle twitching when only both the eyes are involved, where it is called as blepharospasms. These are involuntary closures and they cannot be really controlled by the patient. It can be pretty disturbing, especially when you're talking to somebody, when they're thinking that you're winking, or when there's a lot of disturbance because you cannot open when you want to open your eyes. So, this is the main issue with blepharospasms and hemifacial spasms. So, it generally starts with light twitching, usually in the lower eyelid area, and then it spreads to the entire eye surrounding. And then, when there's a hemifacial spasm, it spreads next to the nose and the lips area where there's constant twitching. When the patient will feel that whenever he's trying to talk, the muscle is going not in the way that he wants to or she wants to go. When it's blepharospasm, there's constant closing of the eyelids. Sometimes it starts with very few episodes and then it slowly starts increasing over a period of time where the frequency of closure keeps on increasing such that they'll be finding it difficult to open their eyes. It takes some time for the eyes to open. So hemifacial spasms, again, there's irritation of the nerve supplying the facial muscles. It can be where there's a blood vessel compressing on the nerve and that is causing the nerve to constantly fire. There's still a lot of work being done as to find out the exact cause of why this starts. Sometimes as on investigation, we do not find any particular reason. Then we call it idiopathic. To rule out any neurosurgical cause, we generally have to do an MRI and go along to trace along the facial nerve to see if there's any surgical cause or like a vessel causing compression, which might need a surgical intervention. Once that is ruled out, then we can go for other treatments. So, rarely, muscle spasms may also be a part of Meeks syndrome. It can also be a part of Parkinson's disease. It can also be a part of Bell's palsy, where there is irregular growth of nerve fibers, causing the patient to have muscle contractions when it's not required. Like he's trying to make another facial expression and his muscle is causing him to smile or his eye is causing him to close. We can also have tardive dyskinesias and we can also have Wilson's disease, which can cause these kind of facial spasms. So these will also be need to ruled out when the patient presents to us. No, hemifacial spasms or blepharospasms